Hi, I'm Ben Chapman. I'm a professor and food safety extension specialist at NC State University. And today, I'm really going to try and touch on communication and behavior change as it relates, specifically to this issue of salmonella reduction, regards to healthy people 2030. So the title that I was asked to talk about today was effective ways to communicate best practices that result in behavior change. And the request really came along with one specific question, and this is actually one of the most difficult questions that I've been asked before. So I want to take a little bit of time to unpack this here. But the question is, what one strategy will have an impact and make a difference in reducing salmonellosis? And I hope that it's okay to take a little academic license in here, because I actually don't think from a communication standpoint that there is one specific or unique strategy that will have the biggest impact or make a difference in reducing salmonellosis. There are a lot of things that we can do that will have some impact. And I'm going to really talk through a multi-pronged approach to answer this question. I actually think that if we really wanted to only invest in one strategy to reduce salmonellosis, it's not our best return on investment or best bang for our scientific dollar is really not in communication or behavior change. It's way further up the production line in controlling pathogens before it gets to a retail space or to consumers. Obviously, that's not practical. And so like I said, I'll take a little bit of academic license here and focus on a multi-pronged strategy to impact salmonellosis. So first thing I really want to talk about in this multi-pronged approach is investigating and understanding what people do and why. And just to give you a little bit of background into some of the work that we do at NC State with consumers, with retail food handlers, with food service operators. We really try to put together, a narrative of understanding from start to finish in meal preparation what's happening. And there are lots of ways to do this. My group's chosen method right now is really a combination of methods using observation to watch what people are doing. We do this by bringing people into kitchens that we have set up with video cameras, and we can see from all angles without any blocking exactly what happens from the time that someone walks into a kitchen to the time that they walk out as we ask them to prepare various items. And so some of the data I'm showing you here was work that we did on behalf of USDA FSIS, focused on poultry washing and understanding more about what it means to wash poultry, why people wash poultry, and what are the microbiological impacts. So we focus on observation. We do a lot of work with in-depth interviews after observing people, but there are other methodologies that are really important here. Starting off with surveys, whether that's electronic or written surveys, to get a sense of what people say they do, and then moving into focus groups where you can get anywhere from 8 to 12 or 15 people around a table and have them discuss and sort of come to some thematic consensus about what actions actually happen and why they happen. My approach, my suggestion here is we have to do all of these things if we really want to understand what people are doing, and that is the first key for me. So we in our study, we observed 300 self-reported poultry washers to understand specific practices. I have a real bias, or maybe a bias isn't the right word. I had a thought of what I thought it meant for individuals to wash poultry, which was open up a package, take it over to the sink, turn on the faucet, and rinse it underneath that faucet. What we found was that's not bad if we wanted to look at the majority. In fact, about 85% of the participants in our study did exactly that. But here's the here's the catch. Here's the nuance of public health. And if we're really looking at reducing salmonella, the majority, yeah, it's important for us to get communication messages to target what that big group is doing. But we may have more success if we start looking at what are the other 15% of people doing, and if we're able to really push the needle, even by decreasing increasing safe practices by 5% across the population, or just impacting thermometer use, or when it comes to this study we were looking at cross contamination. But even we're going to move the needle a little bit, looking at these unique audiences of what they were doing, and I'll share some of that. They were taking filling up the sink or filling up a bowl of water, submerging the chicken in that, moving it around, maybe pulling the skin off, maybe adding in salt or lemon. All these things have different risk outcomes, but people were doing them for different reasons. So again, for me, this number one thing on my list is understanding exactly what people are doing, and not just asking them or guessing at it, but really getting in there and observing. We also found in our study that of people who wash raw poultry, 60% ended up with surrogate pathogens in the sink after washing or rinsing the poultry. And that's really concerning, because 14% still had the surrogate in the sink after they attempted to clean the sink. So for me, it's not just what is it that we're doing when it comes to the handling of poultry, or handling of meat, or handling of other foods, but also how are we cleaning and sanitizing as a whole. So really focusing on deconstructing the practices and then understanding more about that. Some of the outcomes that we saw, again, in this work that was published in a report by USDA FSIS, 26% of the participants that washed raw poultry transferred surrogate microorganisms. We used a non-pathogenic E. coli in or on top of the poultry. We found that in over a quarter of the time transferred to salad lettuce that was also being made as part of this meal. So, my first thing on my list is understanding what people do, talking to them. It's not just observing. We need to know why, because we need to know those triggers. Why is that important? Well, the next thing on my list is really designing targeted messages. And I know that might sound super obvious, but we in the public health world overall actually do a pretty good job at this. In the food safety world, we don't do a very good job at this. Historically, this is the area that I study and conduct my outreach in the most. We're pretty good at designing messages that try to be all things for all people. And that's really somewhat problematic for us if we look at how effective those are. My first place for us to start, though, is acknowledging that, as we're talking here about salmonella, that food in general is risky. It wouldn't take long for any of us to come up with a list of 50, 60, 80 different foods that either have been associated with salmonella illnesses, or certainly we know the attributes of those foods could support the growth of salmonella, or especially in the case of low moisture foods, just support salmonella that persists there. And so first of all, acknowledging that there's a lot of different foods, that they all carry a little bit different risk when it comes to salmonella, and thinking about, well, how I would communicate the safety of reducing salmonella in poultry, as I just showed, is very different than controlling salmonella in, say, raw cookie dough, whether that's in flour as a low moisture food or in raw eggs. And so acknowledging that food's risky, but being very targeted about it. One of the other things that I'll highlight here is that food preparation in general, as we talk about understanding where consumers or commercial food employees, food handlers in retail and food service establishments, where they get their information about how they're trained on how to prepare food, is really messy. And not messy from a microbiological standpoint. It's just a very complicated set of messages. We conducted some work a few years ago looking at food safety messages in cookbooks, and it's really all over the place. Where people go to learn how to cook, doesn't always provide or give them inspiration on what to cook. Giving steps in a cookbook or an online recipe doesn't always include food safety messages. And so it's really, really complicated. We're battling not only like complex processes, but we're also battling that they heard something from a family member, they read something online, they read something here in this cookbook that are all conflicting. And our world in food safety, and especially as it relates to salmonella, we've got to deal with that. I run a group at NC State called the Safe Plates Food Safety Information Center. And the real tenets for us as we develop any message, my team, we really want to identify specifically what's the content, what's the objective that we're trying to focus on, who is the specific audience. If I'm communicating to parents who are making lunches for their kids, that's going to be a very different style of message than if I'm communicating with someone who's elderly and we're concerned about listeriosis from deli meats that have been in their fridge for 14 days. So really understanding content, audience, crafting a message and visuals, putting narrative, both text and visuals together really matters. Take that from really good work that's been done in the area of public health messaging. And then the last piece when it comes to targeted messages that I think we don't really in our world of food safety do a lot of is going through a series of peer review to make sure that we're hitting, first of all, technically we have correct information, but secondly, that we're using peers from the world of risk communication and psychology to ensure that we are crafting messages that that meet the behavior change muster from a theoretical background. Are we actually not just telling people, hey, this is an important practice, but constructing it in a way that fits what we know about psychology and behavior change? The third thing I want to highlight is putting information exactly where it's consumed. So gone are the days, and not to focus too much on other types of projects that we're working on, but I think gone are the days where if we're putting recall information out there about foods that have been recalled for salmonella, whether it's a plant-based cheese like we're encountering right now, or traditional foods that we've seen associated with salmonella, like meat and poultry. Gone are the days where a press release gets that information to people because we're not consuming information in the same way that we were as a society even 5 years ago, where a press release would be turned into a local news story or would arrive in a newspaper, and that's where news gets consumed. Really, I'll highlight that looking to get very targeted messages to people in lots of different ways is important. We ran a pilot project a few years ago where we took one specific message, the one that you see on the screen here, that looking at cooking ground beef hamburgers to 160 degrees, and we put it all throughout different ways, whether it was pre-roll at movie theaters, so like the previews that you see, the ads that are there, on the radio, traditional radio, on podcasts, other audio like Spotify or any audio where there's advertising, Pandora. We try to push this information out there, but even in those social media standpoints, and I'll move to social media here, you can target specific audiences or specific interests. So for instance, now I would go back and replicate that work by going to Facebook and picking out people who are grilling, people who are purchasing beef online, because you have the ability with targeted ads and messaging to do that, to actually drill down to specific audiences, specific interests, and get them information where they're consuming it. The last thing, and that I'll end my presentation on today, is so it's also important that we step back after we do this communication and evaluate. So we start with understanding what those behaviors are. We can use that as a baseline. We create these interventions, we put them out there, and then we have to, at the end of this, really evaluate whether it worked. And it really goes back through a whole bunch of the same thing that I talked about at the start, whether that's looking at observation, whether it's interviews, focus groups, surveys, or looking at actual health outcomes, looking at the public health surveillance reporting of salmonella or other pathogens. One thing that I will highlight here before I end my presentation is we've done some work looking at using eye tracking hardware in our observations to not only understand what people are doing and watching them, but what they're seeing. And this is a really powerful tool when it comes to evaluating messages, whether it's better labels on foods, whether it's messages in social media. If we know where people are reading and consuming this and what their eyes are going to, and we can then measure how that impacts their behaviors, all of these things really need to be wrapped together. So I'll end here. Again, investigating what people do and why, design targeted messages, putting information exactly where it's consumed, and then evaluating. Thank you very much for your time today. That's the end of my presentation.